Hello, everyone. My name is Dave McClain, and thanks for your interest in remote worker, telehealth, and in-home patient monitoring solutions from Extreme. Because of the coronavirus, we're seeing a need to support remote clinical needs, both from a remote worker and from remote clinical, like in-home patient monitoring. And that is what we're going to quickly look at today. But we actually see 4 specific clinical and healthcare use cases developing, and I just want to briefly touch on those or mention them. The first is remote worker, telehealth, and patient monitoring, which we'll touch on in a second. The second is new temporary structures that are near an existing enterprise edge. And this scenario is for testing tents, temporary mobile offices, or other temporary structure near an existing enterprise edge, like in a parking lot of a hospital or healthcare facility. The third is new fixed facilities that are being converted for medical uses, like gymnasiums, open distribution or warehouse space, or large public venues. And lastly is mobile medical units that are out in the communities. In each of these use cases, Extreme has a solution to assist healthcare, and we're all in those together. And this pandemic is pressuring healthcare organizations across the globe. And here in the US, the government is advising every healthcare delivery organization to free up beds and expand capacity. And preparations have included field hospitals and temporary structures, beds in lobbies, and sending patients home. And a solution that can help is our Extreme Defender for IoT. Defender for IoT was specifically designed, built, and tested with healthcare input and feedback. The purpose of Defender application is to secure biomed devices, FDA certified devices which can't be patched, and critical healthcare assets like MRIs, CT scanners, lab equipment, and so on. Defender for IoT can also be used to extend secure controlled corporate access to remote locations like individual employees or patients' homes, where patients might be leveraging monitoring or biomed devices at their homes, and those devices need access back into the healthcare organization for patient monitoring or for clinicians and employees who might be working from a remote location, but still need full access just as if they were in the facility. Maybe they have corporate issued IT devices and phones which need to connect back, and all of this is doable with Defender for IoT. Being able to provide this kind of access is valuable, but we also have to address security concerns. And yes, the United States government has relaxed regulatory enforcement during the COVID event, but healthcare organizations have continued to be targets by hostile actors. And Defender for IoT provides centralized security policies that are consistently applied throughout a group of like devices, where multiple policies can be managed and applied to a common device groups. The solution consists of 3 basic components, and I'm actually going to start or go from the right to the left on this slide here. The first component is the Defender security adapter and the wireless wall plate AP. Both of these devices are the enforcement point for associated policies. And I'll get into the details of these devices shortly, but they allow us to provide wired or wireless secure delivery of corporate networks and assets into that remote location. The second part is the Defender for IoT software. This application resides on the Extreme Cloud appliance, which is located in a data center or customer facility. The Defender application allows for simple and secure access for corporate assets, including home-based care devices. The third and last component of the solution is the Extreme Cloud appliance. The appliance is basically the controller for remote management of the deployed access points and security adapter. These adapters and access points can be deployed anywhere throughout the world as long as there is an internet connection with access to the customer's Extreme Cloud appliance. Extreme has a number of purpose-built access points for every environment, whether it's indoor or outdoor or large public venues like NFL stadiums. The 2 that we are focusing on in this solution is the SA201 and the AP3912. Both of these are part of the Defender for IoT solution with the capabilities to securely connect to customer assets published via the Extreme Cloud appliance and to provide layer 2, layer 7 access rules to that traffic in real time. The AP3912 is an 802.11ac Wave 2 access point that also has 3 wired client ports. It has a 802.3af PoE pass-through port to power phones or other devices. And this AP is extremely flexible in that it can securely extend your specific network like data, voice, patient network, etc., in any combination of wired or wireless. The SA201 is the exact same internal workings as the AP3912, just without the radios. So it is a dedicated security adapter that can secure wired devices, and the functionality, use, and policy enforcement is exactly the same. The SA201 has a single auto-sensing port with PoE pass-through and integrated BLE. And this device can be attached to equipment carts and can be tracked and provide feedback through the application as to last location. Both devices offer complete layer 2 through layer 7 visibility, and for our automated campus or SPV Fabric customers, these devices include Fabric attached for enabled Fabric Connect networks. Okay, now that we know the parts, let's look at how this secures medical devices. Normally, your medical device would be plugged into an access switch. What we do is insert the SA201 or AP3912 as close to the medical device as possible and in between the switch port and the device. This allows us to connect securely to the network and in accordance with the associated security policy. In this example, if it were a Fabric customer, the Fabric and more importantly, the desired service can be extended directly to the client device, automatically and regardless of where the device roams. The security policy will recognize the device associated policy and extend the appropriate service. And in a non-Fabric customer network, there are 2 options. We can extend the appropriate VLAN to the device by policy, and as long as that VLAN exists on the switch port, it'll automatically extend to the device. The third option is an IPsec tunnel from the device through the entire infrastructure and back to the Extreme Cloud appliance. In each of these connectivity options, we would also overlay firewall and layer 2, layer 7 access control features. So on the right, the MRI machine on the top would only allow access to the defined communication allowed for MRIs. Maybe that includes a radiology server or DICOM server and or EMR. It could preclude the communication from or to any other MRI to prevent cross-infection. A quick real-life story. We had a customer who opened up a new clinic, and in the clinic was a brand new FDA certified X-ray machine. Straight out of the box, it came complete with 270 vulnerabilities. So when security scanned it, 98 of them were critical. And in less than 10 minutes in the application of the SA201 Defender adapter, a policy was applied which eliminated all vulnerabilities from being exposed on the network. So also on the right hand of the slide, there can be multiple Defender devices with each are applying in-device specific security policies. So this eliminates potential cross-infection of viruses or ransomware exist on the network. Profiles are based on whitelisting and the creation of authorized communication channels. It's kind of like the least privilege approach. So the minimum necessary for the device to function. And in this, the MRI machine is using DICOM to communicate to an imaging server, and that communication is allowed. DICOM to another unlisted imaging server or any other traffic would be dropped. And in this case, it is allowed and the image flows through the allow rules into the imaging server where it is reviewed from a viewing station. Policies are centrally managed and administered. This means a single policy can be applied to one device, like this MRI machine, or to 500 devices via a group. So administration is based on a single centralized policy. If the access isn't defined in the policy, then the adapter will not allow the communication or the connection. Here we show how an unauthorized device would be blocked. An infected MRI machine would not be able to infect other devices, and a hacker won't be able to connect to a protected device. Earlier, I mentioned that we can tunnel across an existing infrastructure. This includes the public internet. Here we can create a policy-controlled secure access to patient devices at a patient's home, again, wired or wireless. The policy and administration remains centralized and controlled access to a dedicated corporate remote patient monitoring network or other appropriate service. The same solution for remote medical staff, and teleworkers or other remote staff. The policy is applied by device grouping, desired service, and even pass-through end user authentication. So it truly becomes an extension of the corporate network. Home or patient-side extension of Wi-Fi can coexist. A home user or patient, employee, or medical staff member can have both wireless networks available to them and based on the device which they are using at home. So a corporate asset or biomed device will leverage the remotely delivered Defender network services while their personal devices will remain on their private home network. And policy can control and block any non-corporate or defined asset from connecting. So in summary, we have the ability to protect critical medical devices, FDA certified devices, or PCI DSS point of sale devices. Any device which requires the additional security services. And we can scale the number of devices to tens of thousands through additional controllers or through geography. And when deployed with HA controllers, which is highly recommended, the resiliency allows the Defender device to establish primary and backup links to the appliances with automatic failover. Thanks for watching and come along with Extreme to advance with us.